Hi, I'm Susan Chappell, and for the next 3 to 4 minutes, I'm going to change how you screen for the risk of prescription opioid abuse in your practice. Do you currently use evidence-based practice tools in your practice when it comes to screening for abuse issues? Evidence suggests that you do not. Have you tried individual checklists as a way to screen for the risk of substance abuse? Is one of those checklists related to ADRBs? Aberrant drug-related behaviors. While ADRB checklists are helpful, I'm here to tell you that used alone, they are not enough to screen for substance abuse risks. So let's have a look at what I've done here. First, I developed my research question using the PICO method, which is population, intervention, comparison, and outcome. And that left me with the question, will completing an aberrant behavior checklist on patients using prescription opioids adequately identify those patients at higher risk for substance abuse? And the answer is no, not completely. So after a detailed search and analysis of related articles, I've settled on 4 articles to review. And what I found was all of this, which you can see in the PowerPoint presentation. The conclusion of the literature review is that the use of an ADRB checklist alone is not sufficient enough to monitor patients for the risk of developing substance abuse. And screening for risks of substance abuse might be done in a more systematic and standardized way and done at regular intervals through the course of the patient's treatment on prescription opioids. Now, don't hang your stethoscopes up just yet, because I have a solution. A team-based approach to screening for the risk of substance abuse in patients with chronic non-cancer pain. I have developed this algorithm, and this algorithm will guide you and your team through a series of steps that will provide consistent care to your patients on opioids by incorporating multiple evidence-based practice tools and by using nursing staff to support your work. And we cannot forget about the use of the aberrant drug-related behaviors checklist. Remember, this tool is useful, just not sufficient to be used in isolation. But we can't start with the algorithm just yet. First, we have to ensure that we're all on the same page. And how are we going to do that? Good question, my friend. We're going to use this framework right here. And this framework is by Godden and his colleagues, and it's going to guide you on a journey to understand your self-behaviors and your intentions as they relate to incorporating evidence-based practices into your daily work. Then I will provide you with an education session, similar to the one that I've provided you here, where we will review the Canadian guidelines for the safe and effective use of opioids, right here. We will also review all the tools that you now will use in your practice. We'll look at other resources that are available. And finally, we'll discuss how to integrate the algorithm into your practice. Then we'll be ready to start using the algorithm. Now, you might be thinking that this sounds all too easy. Well, there are a few things that we need to consider first. Things like how to make this work in other practices that are not working in collaboration with nursing staff. And things like defining roles and responsibilities. Considering what might the patient's response be to this team-based approach. And how to ensure consistent documentation without an electronic medical record system. This leaves us with a few next steps that need to be finalized. And these include developing a training module on how to use the algorithm, including what to do with both positive and negative results. Offer education sessions. To develop one single flow sheet which will allow for simple yet consistent charting. And develop and implement an evaluation model. So stay tuned and I'll be happy to provide you with more information as we gather it up. So cheers!